Hi, Dr. Saxena here, and we've been talking about what exactly can be done when it comes to something called autism, and the kind of things what we are talking about now. I had I've seen a lot of parents, and when we are talking about that, everyone is trying to understand what might have caused this and all that. I have been talking to them, having worked in this field for some time. 2 decades, for the last 2 decades, I'm with autism, trying to work on that, and now I believe there are some things which could have been done, and what I mean to say is. You pick up the subtle signs of autism spectrum when it's early, and it is and you can always start on the things kind of easily, so that you can always do some prevention. In the sense, it's not just prevention, it is trying to pick up early and trying to contain the disease. That should be your focus, and exactly this particular thing made me talk about this particular thing. And there are many theories like about why autism rate has exploded. Some think it is due to the different schools of thought, and we believe, yes, there is not one particular thing which is a constant kind of for this one. And this for me, I try to there are, it's not right to blame the kind of thing. People started blaming on the maternal age at the time of conception. Still others suggest the mix of genetic predispositions and environmental factors, including the dramatic number of increase in number of vaccines given before the age of 5, and is a more likely cause. But what happens is that there are always difference of opinion, and the experts have a belief that yes, something is. We are still trying to figure out what exactly is this cause. There's no need for debates and all that, and more and more our children are impacted by this condition, and we need to look forward what can be done to at least contain the pick up early or contain the disease. And see, so see, during this particular thing, when I was dealing with a lot of autism, the moms of the autistic kids, and they want to have another child, and they used to tell us what to do, likely chances to him get a healthy baby. That was the main question mark kind of stuff, because what they have found was this kind of statistics what we tell, that likelihood chances of getting a second baby, having a 60-70% chances of getting autism is a big kind of stuff. So this made me come up with these strategies, how you can think of new strategies of carrying, birthing, and raising healthier children. And this applies to almost everyone who is who don't have a kid. Also, they want to see that their children are going to be healthy, and that's the reason with this segment. And all things have been said about autism. There are some metabolic dysfunctions associated with autism, and what are the safe and effective interventions to treat these conditions. There are a lot of being told about. I happen to look into something like Autism Research Institute. When we started, Dr. Bernie Rimland, so he instilled some sense of urgency into this group, and his mission was to focus on solutions that will improve the outcomes, lives of the children living with autism, rather than conduct a research what might have caused and all that. And I always believe, you have problem at hand, try to fix that particular thing. Again, you need to know why it has caused. That's also there, and see that further this the chances of getting into the second kid also as autistic has to be worked out very diligently. And so there are several patterns of metabolic dysfunctions in autism population. They had always gastrointestinal dysfunctions, which was something like we used to call it autistic enterocolitis. This Andrew Wakefield did a big research, and he came up with his thing about MMR causing this one. But the main part with autism is the children, they are either having diarrhea or they are having some constipation, they have some reflex. You have got gastroesophageal reflex. They have got increased hyperpermeability of the intestines, and decreased enzyme production, particularly when it comes to DPP4. And apart from that, there's a constant thing is a abnormal micro flora. What I'm talking about, microbiome. Microflora is a kind of good bacteria which is there in intestines, and there's always a balance between good and bad bacteria. And so when you have this dysbiotic flora, which is more bad bacteria than the good bacteria, the things are going to. Apart from that, you have got some neural inflammation, and we have seen some sizes of the brain also was quite high. I had done ultrasounds. I picked up something like high uh, BPD, which is called biparietal diameter. Biparietal diameter on ultrasound, we used to tell that okay, this guy has got something like head volume is quite high. There was apart from that, in autism you had something like neuroinflammation, and there's apart from neuroinflammation, there was a decreased blood flow to certain parts of the brain, and which was proved on PET scans. And there were some hormonal imbalances, and usually of this cortisol production, dopamine and serotonin, there is a kind of disbalance between this. And yes, always there was a immune dysregulation. There was a shift of TH1 to TH2, and this was and there was a pro-inflammatory cytokines. So this was the basis, and most of the autistic kids, when we started working on their methylation capacity, which was oxidative stress indicating, so they had they have a decreased methylation capacity by when we picked up something like lowered methionine levels and other markers such as increased homocysteine. Homocysteine was marginally increased, and apart from that, they all of them had a lower levels of glutathione, and they had increased lipid peroxidation. And yes, serum B12 levels were also low, and there were some other tests we did something like decreased carnitine levels, which indicates he or she had mitochondrial dysfunction. Apart from that, there was lactate also was quite high. So so as parents and clinicians, we as a parent and as a clinician both work feverishly to address these abnormalities by assessing each child with individual issues and attempting to normalize or correct the disturbances. And it was this particular take. Then I started. We saw children improving in speech, behavior, cognition, attention, as well as general health. And some of these biochemical abnormalities may be preventable. That's what is my focus. And you need parents to understand it, and they need to work optimizing their health prior to conceiving. That will make the healthy children, and they will not get into something like autism. So as a board certified material toxicologist, clinical material toxicologist, as well as a radiologist, I have two feathers in my cap. I'm a physician as well as a radiologist. So been more than 3 decades now. Now I try to work on imparting a lot of natural therapies, trying to work on some simple things like oxygen therapies, doing some detox, and it's like trying to not to drug the body more. So my practice is mostly into working with the nutrition, trying to see that some things happen. So I try to work out. I having attended a lot of DAN conferences, there are other stuffs, and trying to work on this particular thing. And we conducted a lot of events also, working on this autism protocol. And I believe this biomedical approach parents should tirelessly implement, which is a combination of detoxification, nutritional supplements, and some kind of biooxidative therapies also. This will help, and them immensely. This is my personal kind of thing, because I was not very keen on this kind of therapies, which is as simple as getting into pulse electromagnetic field. The child kept for 8 minutes during the for a period of 21 days. It makes a big difference. And having had a child who is not detoxing by himself, what is happening is that his detoxing skills are poor. He doesn't sweat properly. He has a bowels issues. His liver is not optimal. Other things he doesn't. So we believe that is the reason we started working on this particular thing. We started doing some oxygen therapies, detoxification, and all that. So. So my take is, again, I always tell autism cannot always be prevented. There are some things like genetic components and all. But if you are, I am really working on something like epigenetics now, where I believe there is an environmental insult which adds to the process. You may be having genetic predispositions, but you may or may not get a disease. So this is one thing which we are excited with a good nutrition, trying to remove the external toxicity and all, and trying to work with good this one. We can always keep this imbalances. We will certainly can prevent this thing called autism. And yes, I encourage couples, whether they are contemplating pregnancy or currently pregnant or already having an infant, to follow some precautionary principles to minimize the risk of autism. These strategies may involve minimum exposure to environmental toxins, maximizing the nutrition and general health of the mothers at all stages, providing superior source of nutrition, and trying to see that what are the allergies and all that. And I try to work on individual consideration on the use of vaccines. This is one thing which we always have a say here. Of course, there are no guarantees, and there are. I think there are more than 40 parents followed our things, and the second kid, the first kid had autism, and the second kid were more than 40 parents had complied with all our this one, and the second kid was absolutely normal, and there are no problems with and the risk was quite high, but still we were able to work it out. So I figured out some of the things like doing some do's and don'ts. I can always come on that particular thing, and there are some things, rules to be followed prior to conception, during pregnancy, and of post pregnancy. What are these particular things? And you can always write to me. I can always help you. And there are some simple steps which we can always follow, and which can help you see that your child is healthy, as well as it doesn't cause any, and you are effectively you are trying to prevent the thing called autism. Thank you.